So let's start.
Hi everyone, this is Dr. Akram here. So I'm from Australia currently. So I'm basically a pharmacy lecturer here in University of Sydney. So I also make content for you guys to make aware, the opportunities in Australia. Today I'm going to discuss the opportunities for nurses. So if you are one of the nurse looking to migrate to Australia and New Zealand, so you can ask any question. Apart from this, if you want to ask, any other questions, if you have related to nurses also, you can ask after this webinar. Okay, so I will interact with you one-on-one. So if you have any questions regarding jobs or visa, exam, or anything you can ask whatever you have questions regarding this. So today is not just the NCLEX exam going to talk, but more than that, like jobs and visa and all those things. So whatever you have questions, you can discuss with me. So academically, the Australian attack, and we provide the assistance for all healthcare professionals like medical doctors, dentists, nurses, physiotherapists, pharmacists, optometrists, and so on. So if you are one of the nurse, we focus on this, but we provide the assistance for all healthcare professionals. So this is about myself. So I'm basically a Indian pharmacist. So I completed my bachelor's, master's, doctorate from India, and I also completed my PhD from University of Sydney. So I'm here as a lecturer, and I have around 11 years of teaching experience in India, Malaysia, and Australia. So now I'm making basically the content to healthcare professionals to make aware the opportunities in abroad. So here are some of the faculties. So if we talk about the opportunities in Australia for nurses, so if you see this is the first article, if you can see here in the SPS they published recently. So the critical shortage of the 10 top 10 occupations, nurse one of them. So that's why they are giving a job in very short time. The visa also you will get in very short time as compared to others. For example, someone completed a engineering degree even from a top uh, college, for example, from IIT, is still they need time around 1 year to get the visa granted. But for nurses, it may take around within few weeks to get the visa done. So a lot of vacancies are available currently for nurses. So it's the right time to migrate to Australia as a registered nurse. So Currently the job opportunities in available are 12,000 plus vacancies in Australia currently, and every year is going to around 14% growth in terms of jobs in Australia for the nurses. And if we talk about the salaries, so this is about on an average 83,000 Australian dollar the salary yearly. So this is the, and Australia basically provide a permanent visa and PR visa or the citizenship. I can see 195,000, and out of them, I can say the nurse is the highest numbers of nurses are migrating to Australia. So apart from this, there are some other advantages to migrate to Australia. For example, the education for free for the families, for example, your kids or your wife or your husband, and healthcare access also free. So if anything happened to you or your family, there will be no insurance need to buy. For example, in case of you're migrating to US, in US you need to buy insurance for you or your family, but in Australia there's a universal health coverage, so no need to buy anything here. And very high earning potential, as I mentioned, this is like 83,000. This is on average. The nurse can earn up to 100,000 per year easily. And quality of life, if we compare from our own country, from India, is very, very high here. And opportunities, as I mentioned, there are a lot of jobs here with permanent residency in PR visa. And there's a work-life balance. You just need to work only 8 hours. And after that, you are free. Whatever you want, you can do. You can give the time for your family. Professional development, for example, if you want to do any course, any workshop, any conference you want to attend, then call the university or hospital will bear all of your expenses. So this is a very learning environment in Australia. So easily you can do if you want to do any other course apart from based on your interest. So NCLEX eligibility basically the 4-year bachelor degree, not the GNM. But if you did your GNM, that 3-year diploma plus post basic nursing, still you are eligible to work in Australia. So they need basically 4-year bachelor degree plus you must be a registered nurse in your home country. This is the eligibility for this exam for Australia. So here are some of the steps you need to complete in order to migrate to Australia. So the first step called initial skill assessment, or we also call document verification. Okay. So the first basically self-check with APRA, then you have to pay the fees, $640 Australian dollar, and then there's a 1 hour basically recorded session for you regarding the Australian healthcare system. Then you have to make your portfolio in APRA. But this look like there's a 4 step, but it's just a 1 step, easy step you can do yourself, or academically will help you to complete this step. So the step 1 we will complete for you. So no need to worry about this. Then there is a step 2, you need to write this NCLEX exam, and we will provide you the coaching for 3 months. So you will definitely, you can crack this exam in your first attempt. Okay, we will provide you the live classes, live sessions, plus study material, and plus the lot of mock tests for practice for you. So very, very easy exam. I can say you can pass in your first attempt and NCLEX. And then we will also provide the coaching for English as well. So once you pass this NCLEX, you also need to pass IELTS or OET or PT. TOEFL basically recently they removed my this PPT I created last month. So recently this TOEFL removed from Australia for the visa purpose, but still you can use to register for the registration as a nurse. So generally, we will highly recommend it for you to go for IELTS, OET, or PT. So we provide the coaching for this as well. So all these 3 steps we will help you to complete, and then you can then you can start looking a job. We will also help you to find a job in Australia. We provide a job assistance as well. Then you can come to Australia, and then you need to give OSCE exam. Okay, then you will get full registration, apply your PR visa. So after this, you can migrate Australia on a work visa, most likely. After once you pass this English and NCLEX on work visa, simultaneously you can clear OSCE in Adelaide in Australia. Then you can become a registered nurse in Australia. Okay, so most likely once you clear this NCLEX plus English, you will definitely will get the job. A lot of vacancies are available in Australia, so easily you can move to Australia. So English requirement, basically we need 7 band in IELTS individual, or same in 65 in PTE, or uh, grade B in OET, or 360 350 individual score in OET. So these are the documents required for this, but we need your scan copy, color scan copy, and then not verified by any lawyer, and then you just send us a scan copy of that. In a PDF format. We need your degree, transcript, work experience if you have any, valid passport, government ID, passport size photograph, nursing registration is mandatory. So NCLEX, basically, as you know, this is an online exam, and minimum basically score you need to attend at least 75 questions, and maximum to 65 questions. Maximum hours, this 6 hours, basically maximum hour duration. But sometimes, if you given the correct answers, it might, you just need to attend 75 questions only. So no negative marking in this, and mostly will provide the coaching for 3 months for this NCLEX. And then you can, once you complete all these steps, you are eligible to apply PR visa 189, 190, or 491, or these are the work visa you are eligible to get. Okay, so these three is the permanent visa, but these two are the uh, work visa. This is basically a regional sponsored visa. So they will give you the visa for 5 years, but you have to live and work for 3 years in regional area. Then you will get your PR. So these are some of the fees you can discuss with our team. Basically, we also provide the EMI option or loan facilities for Indian citizens. So just talk to our team regarding the financial assistance. We also provide the scholarships. Right now, we're providing a lot of scholarships for NCLEX. So talk to our team. Here are some of the reviews from Academically from our previous students. So now we can talk one-on-one. So if you have any questions.
So I guess Jay raised his hands long time back. The first person to raise the hand.
Okay, you can ask. Can you please unmute yourself?
Jay has actually put a question on the chat box as well. What is the minimum requirement of OET?
B, as I mentioned, is B, or 350 individual score.
Jay, if you have any
Uh,
questions, you can unmute yourself.
Hello, hi sir.
yes, hi Jay.
Hi. Well, actually, I'm already in Australia. I'm currently pursuing master in public health.
Okay, so you are a registered nurse in India.
Yeah, I'm registered nurse in India. I completed bachelor in nursing from in 2017. Then after I have continued work experience as a nurse in India.
Okay, so you
After
just basically, Jay, you just need to pass this NCLEX.
yeah
Since you are already in Australia, but it's very easy for you to get PPR.
yeah
So you can go any English test, not just the OET. OET you can go, or IELTS or PTE. So
yeah
we provide the coaching for OET as well, OET
yeah.
or PTE or IELTS.
Okay, yeah. And what about the coaching? Means how will you provide? Will be online
Sure.
or
Online coaching. So
okay?
we have app Android or iOS, or you can desktop you can use. We have our LMS. We'll provide the live sessions there, and the other recorded. So if you miss any class, you can
The
later on
flexible.
watch. Yeah,
Okay.
and live sessions, at least you can ask whatever you have doubts. With the lecturers. Even hi Kavita, how are you? Even one of our lecturers here. She's hi Kavita.
Hello, sir. I'm good. How are you?
I'm good. Yes, yeah, quick questions है अभी when you can ask our
No,
lecturer.
no, sir. No, thanks.
Okay,
Thanks for the
thank you.
day.
Thank you.
I'll connect to your teammates.
Yeah, yeah. Sure, sure. Jay. Yes, guys. कोई question है? So our lecturer also with us. So even you can ask her if you have any specific question
Hi,
regarding it.
I'm Jamuna.
Hi, Jamna.
Yeah, I want to know how is it this NCLEX exam? What kind of exam it is actually?
Kavita, if you can just explain regarding this NCLEX.
Yes, sir. So basically, NCLEX exam, as sir has told a little bit about it, but a few things have changed since April 2023. And the number of
Okay,
questions have changed. So now the
okay,
minimum number of questions you get there is 75 or 80 or 75, and the maximum is only 150. And there's the pattern of the questions also. The major of the questions remains the same, but they have added case studies also. So for
okay. So
every
it's a
18
medical exam,
questions
right?
This
related
is
to
not
nursing,
for nurse.
Oh, related to nursing.
uh,
Okay,
yeah,
great.
related to the practical things which the nurses do. Basically, it's not mainly theoretical; it is practical only. Means your practical knowledge is tested.
Okay,
So you get
okay,
5 hours to complete the paper, which is online, and in between you can get breaks also. But the breaks are also included in those 5 hours.
okay. I got it. Thank you.
Okay,
Okay, I
thank you.
understand now. Thank you.
Good evening, sir. Good
Manpreet,
evening, ma'am.
Good evening.
Uh, Myself, Raviraj Sawant. I'm speaking from the Maharashtra, India.
Okay.
The questions will be means situational type, right?
Situational questions are case studies. Others will test your practical application of theory only. So you need to study the theory, and then we will give you a lot of questions for practice. And situational is case studies, which will be means around 7 to 10 case studies throughout the paper.
Okay. Thank you.
Thank you. Yes. Anyone else? Any other question?
Manpreet, you can ask your doubt.
Manpreet, can you please unmute yourself? This is Nishant. Same Manpreet. This is our student in CAPS. Our
No,
sister.
no, no, sir, no, sir. Different, sir, different.
Okay.
And Zamoon, you can ask.
Hi,
Anjita,
sir. I'm from Bangladesh.
Okay.
Anjita, yeah.
Hi, Tanzita.
Sir, I have completed my bachelor degree in here in nursing, and I
Okay.
also completed master's in public health.
Okay.
Now I'm interested to go abroad, and I see your page in Facebook. Then I admit it here.
Okay. Okay.
Sir, I just want to know that is there any opportunity for Bangladeshi nurses to go
Yes,
in
I
there?
mean, this is like, any overseas nurses can migrate. This is not just for Indian or Pakistani or Bangladeshi, they will you don't see the nationality. So you just need to complete this process like, document verification. This we will do. You just need to provide us your document. Then you need to pass this NCLEX exam. We'll provide you the coaching for this exam. After that, you also need to pass one English test. We'll also provide you the coaching for that as well. Then easily you can migrate from Bangladesh to Australia.
Thank you.
Thank you. Yeah, Divyam. Can you please unmute? Divyam?
Hello. Can you hear me, sir?
Yes, yes, yes.
Sir, actually, my name is Raviraj Sawant.
Okay, Aviraj. Okay.
Okay. I am asking that previously you said that the pricing or the charges for the 825 something on Australian dollars,
Hmm.
right, sir? Those are
No,
for
I haven't told anything in regarding the fees. You have to
in
deal with our team. You have to
okay.
talk to
No, no.
who's
This
the
was about something registration fees.
registration. Basically, you have to pay to no. This is 6 or something, 680 or 650 something. I told.
Okay.
I think 6 60 or 650 something AUD.
Okay.
That for registration, basically, they will check your document, like your degree from where you did and your registration. Then they will let you know, yes, you are eligible to sit in the NCLEX exam.
Okay. So
After
the
that, after that only you can book the exam. Before that, you cannot book. So the step one mandatory is document verification.
yes. Okay. And the exam NCLEX examination fees will be different, right, sir?
Yes, वो फीस आपको अभी टीम बताएगी. आप अपना
Okay.
फोन नंबर ईमेल छोड़ दीजिए, वो हमको बताएगा. अभी आपको वो
Okay.
हर एक स्टेप में इंग्लिश का अलग हो गया, एनक्लेक्स हो गया, डॉक्यूमेंट
Definitely, sir.
वेरिफिकेशन हो गया, और वीजा का कितना फीस होगा, वो सब हमारी टीम आपको बता देगी.
Okay, sir.
Even
Thank
we
you,
are
sir.
providing the assistance also, for EMI also. You can pay in 6 months, 9 months, 12 months.
Okay. That's a great
Yeah,
thing, sir. Thank you.
yeah. Thank you. Please leave your phone number, email in our chat box so our team can connect to you.
Okay, sir. Definitely.
Yeah. Anyone else have any other question? Yes, Paras.
Hi, sir.
Hi.
I actually have a question regarding the experience. So, is the Australian nursing experience valid in US?
Even Indian experience are valid in US. So why you are
No, sir.
asking this?
Like, for instance, let's just say if I want to get into CRNA school, right, and like the requirement is to have experience for 2 years in some critical care setup, right? I'm asking
Yeah,
that kind of.
yeah, definitely. Australia is the one of the our high income countries. Even if you in any of the world, US, UK, Canada, everywhere, it will help you. Yeah, they recognize your work experience.
All right. All right. Thank you.
Thank you. Even if you registered in Australia as a nurse, then many countries, it can be open for you. There is no need to have another separate registration. Especially in these Gulf countries, they recognize anyone registered already in US, Canada, UK, Australia. So no need to write any other exam in these countries as well.
Right, sir. Thank you, sir.
Sure.
Jake, you can ask a question with Dr. Akram sir directly.
Jay ने पूछ लिया already. ये RK
Sir,
Biswas. Do you have any question, sir?
सर जे का एक और डाउट है सर वो कुछ.
Okay. Jay क्या पूछ रहा
Not actually, sir. I've just
है?
registered here very recently.
Okay. So if you have any questions, any doubt, so you can ask. Are you a nurse?
Yes, sir. I am a registered nurse from Bangladesh. I have completed my IELTS and want to sit for the NCLEX exam.
Okay. So yes. So basically, have you done your skill assessment? Not yet. Document
No,
verification.
not actually, sir.
Okay. So we can help you in documentation. Then we can help you to crack your NCLEX. English you already crack, so easily you can get a job and can migrate directly to Bangladesh to Australia.
Okay, sir. But my first priority is USA. So can you help me for this country?
Yes, I mean, the NCLEX is the same, whether it's the US, Canada, or Australia. Right. So we
But
can
so
help.
far I know, I have browsed the website and found that Australia is much more harder. The process is lengthier.
No, it is very, very easier. This is the one of the country, I can say, because we are providing the courses for, it is not just for nurses. We provide medical doctor, dentist, pharmacist, lab technician. I am living here last 6 years. More than 1,000 students from Academically already passed. They are living and working in Australia. So I can say Australia one of the easiest pathway. You just need to crack NCLEX. Already you English pass. You will get work visa. Come to Australia and just you need to go OSCE. You will get a PR visa immediately. In US, might take 5 years or many years to get green card. Same for UK. Okay. So in Australia, you can get instant. You can get the PR visa. None of the other country provide. Yes, UK, Canada provide the but they also need high score. But in Australia, you have minimum point 65. You can definitely can get the PR visa. But in case of US, you have to wait several years to get your green card. But it is your choice. We can help you for US. We can also can help you for Australia. But Australia is a very easier process as compared to other countries. Yes,
So another one.
yes, go on.
Okay. So after completing the NCLEX, so what will be the procedure for the OSPI?
You just need to apply. In Adelaide, there's one center in Australia. You need to come in Australia and you need to sit in the OSCE.
Okay. So all
Directly,
the informations are available in the website, right?
yes. We will also launch that program once you pass this NCLEX. That if you need
Okay.
assistance for OSCE as well.
Okay, sir. Can you, sir, compare the benefits between USA and Australia in case of NCLEX and OSPI? Because USA, they don't have any procedures like OSPI.
They must have something. Without OSCE, most of the countries, they are not recognized because everywhere you need to pass two exams. It is not just the nurse. In Australia, medical doctor, dentist, pharmacist, lab technician, everyone has to go into this process. This process is mandatory. Even for locals, those are graduate locally, they did nursing here. They also need to go for OSCE. So OSCE really very important to assist, especially this those are graduates from overseas. So it is not very tough exam. It is very, very easy exam. I'm one of the lecturer for OSCE, especially for pharmacists in Australia. So I think in last 10, 11 years, I'm, teaching for this OSCE for pharmacist student. So this is really an easy exam. There is several stations. You just have, if you can just check few videos on YouTube, definitely you can find. It's not that much tough, that impossible to pass, and this OSCE exam. And nursing, I can say like more than 80% student pass in the first attempt is OSCE. So OSCE is not some difficult exam or something. But getting a visa in within a few days you can get. But in case of US, might take 10 years to get PR, your green card. And without green card, you have to pay every year, for insurance, lot of other, disadvantage to migrate to US as compared to Australia. So I can say the OSCE is not a, and the problem is a easy exam. Anyone can crack. Yes, Jay, are you asking some question?
Yeah, yes, sir. My concern is that like we have to provide English proficiency result after cracking the exam, means before OSCE or after OSCE.
You need basically, when you are registering with APRA as a provisional registration after NCLEX, at the time you need to provide English before OSCE.
Okay. So that means we have to prior we have to apply for APRA for pre-registration. Then after we book NCLEX written
You need
exam.
to apply for APRA, you need NCLEX plus English.
Okay.
Okay, then you will get a provisional registration. Then you need to pass OSCE, then you will get a full registration or general registration.
Okay. Or before getting the full registration, we can work as an enrolled nurse or a.
Definitely in Australia, a lot of jobs basically, even in the aged care sector here and there. Definitely you can. Even once you clear caps, you can get basically 482, 494 work visa. And once you clear NCLEX, you can directly, once you clear this OSCE, you can directly apply for 491, 190, 189, any PR visa.
And I'm a fully registered nurse here.
Yes. Once you pass OSCE, you will be a fully registered nurse.
All right, yeah. Okay, thanks.
Thank you. Yes, guys, any other question? Or maybe someone on YouTube? Any question from YouTube? You are watching here?
Checking once.
Okay, guys, if you do not have questions, then we can finish here. Please leave your phone number and email in our chat box so our team can connect to you. So we can finish it now. कोई questions नहीं है
Yes,
अभी?
yeah. We can finish.
Okay, sir.
Yes,
Thank you,
sir.
sir.
Hi, Tejas Thakur is joined just now. Hi,
Falungi
Tejas.
and Solanki. Falungi. You also doubt.
Hi, Tejas, you just joined. Any question? और फाल्गुनी सोलंकी कोई क्वेश्चन है आपका? Okay, Kavita, I think we can leave. There is no more question. Thank you so much, Kavita. Bye.
Okay, sir. Thank you.
Bye. Thank you. Bye.
Bye, bye. Thank you, sir.
Bye. Thank you.